Hello and good evening. I'm Melisa Idris. Welcome to Consider This. This is the show where we want you to consider and then reconsider what you know of the news of the day. As ASEAN leaders prepare to meet for the ASEAN summit early next week, humanitarian crises around the world continue to unfold with devastating human consequences. What more can this region do to help, including countries like ours, Malaysia? Now, today on the show, I'm joined by Dr Javid Abdelmoneim, who is the new international president for Médecins Sans Frontières, also known as Doctors Without Borders. Dr Javid, thank you so much for being on the show with me today, and congratulations on the appointment to the role recently. I understand that your connection with MSF goes way back to your days as a medical student. And I'm just wondering, what drew you to the organization back then, and how has this long journey with MSF, how will it shape your role going forward?
Thank you for having me, Melissa. Yes, I first came across MSF in the year 2000 while still at medical school. And what drew me was this sense of refusing to accept that patients and communities can be violated or neglected around the world, and that sense of refusal, which then compels us as a collective, as a group of individuals that manage the organization, to get up and go across the world and join our colleagues and staff who are living through these conflicts or contexts, to make teams to bring around a little bit of care through the medical or humanitarian act. And that's what kept me going. So after medical school, I then joined the organization in the year 2009, and I went to Iraq and Haiti in that first year. And on and off, I've been working with the emergency teams of MSF all the way through, whilst also keeping a career in emergency medicine in the UK National Health Service, because I was in Sudan this year, I was in Gaza last year. So bringing that experience into the boardroom, I think, is really vital right now, because we're seeing changes around us in the humanitarian and global health sectors, and we need to prepare ourselves and get better at what we do to be able to meet more needs.
What do you mean by changes in humanitarian needs? Could you elaborate a little bit?
Yes, indeed. I mean, we're seeing massive reductions in humanitarian and global health funding over the last few years. And whilst we're financially independent, Melissa, we're part of a wider aid and health ecosystem. So if you imagine UN agencies such as the World Food Programme or UNICEF are having major cuts, and that has a ripple effect outwards. So not only would other agencies that are dependent on that funding or on those UN agencies, that they're falling away, and we're increasingly finding ourselves alone or one of the few there. So we're having to do more with what we have. Or even, for example, to give you a really concrete example, we would have been receiving donations of therapeutic foods from UNICEF or from the World Food Programme to use in our own programs. And now we're having to purchase that ourselves. So the cost for us has gone up to just stand still. And whilst we're seeing greater and greater needs around us, it's a very difficult time.
You mentioned that before the appointment to this international presidency, this role, you were in Sudan, you were in Gaza. Can we talk a little bit about the humanitarian crises that are happening there, what's happening on the ground? Let's begin with Gaza. There's a fragile ceasefire in place. What are your teams telling you about what they're seeing on the ground, what the current situation is? Are we seeing aid come in, supplies being allowed in?
Yes, I mean, the ceasefire really brings around a feeling of hope, but also a huge amount of uncertainty, Melissa. For nearly 2 years, there was an extreme amount of violence, bombardment, real unsafety for the population, and food used as a weapon of war during this genocide. And so the ceasefire brings a relief for this exhausted population. The issue here now is that we need to see that sustained. We also need a massive, massive increase in the aid and supplies being allowed in by Israel. There hasn't been the type of quantity and volume increase that we'd like to see going in. And it's not just medical supplies. We're talking food, shelter, equipment, fuel, everything is needed for the population right now. So yes, the cessation of overt violence is a good thing, but that needs to be accompanied with so much more. Another thing that we're actually really asking for is that, the health system was destroyed actively by Israel and its forces. Attacks on hospitals, attacks on staff who have been killed, detained, and tortured. One of our orthopedic surgeons is still detained for longer than a year, and also blockades on supplies. So there are more than 15,000 patients, cancer, chronic diseases, who are complex injuries, patients who can't be treated in the health system as it stands right now, and they need medical evacuations. So in this moment of ceasefire, this is when we need open passage and massive increase in medical evacuations. So a moment of hope, but still a huge amount to do, and a real urgency to have a sustained ceasefire.
All right. Given how the previous ceasefires weren't sustained, how is MSF working through the uncertainty? With the hopes of the crossings being opened, with medical evacuations being allowed, with more supplies and aid to come in, are you planning for that, or are you dealing with the current situation as it is, with whatever is available now?
We're doing what we can. We've been in Gaza working uninterrupted since the start of all of this, and so we have 2 field hospitals. We work in 2 Ministry of Health hospitals, supporting there as well with maternity, trauma, and burns. We also have primary healthcare clinics and water distribution sites. But the issue here is it's just simply not enough. No one agency and no one NGO can do what's needed. I mean, there has been a wholesale destruction of all the pillars that are needed to sustain life in Gaza. This was a genocidal campaign. So the water and sanitation system, the health system, shelter, transport, these are all crippled, and we're going into winter. And winter in Gaza is difficult. There are storms. People have been crowded in to a sandy enclave within the enclave, right on the beach. People are living in tents at the waterline. It's really unpleasant, and we will have a greater increase in all the illnesses that you often see in winters. And when you have a starved, hungry population that's already beleaguered through 2 years of war, then any small illness can just tip you over. So, and we're seeing about a quarter of pregnant and lactating women are malnourished in Gaza at this time, when we did a survey in our clinics in July. So this is not a normal, healthy population coming into winter, and they're going to need absolutely every amount of support from all regions in the world. So we're looking to ASEAN, we're looking to Malaysia as the chair of ASEAN, and at this moment to really convert that political support that we've seen coming from Malaysia especially, which is really valued, into action. And something concrete that Malaysia and ASEAN can do is the evacuations. There are 15,000 patients waiting for medical evacuations. This is simple and straightforward to do. Many regional countries have taken thousands. That's something we're calling for as MSF that ASEAN could do, but also to bring their full diplomatic pressure, to sustaining that ceasefire, open and unrestricted aid entry, and large numbers of medical evacuations, please.
Can I ask you, Dr. Javid, I mean, in the past 2 years, in this past 2 years of genocide, I'm sure there have been countries that have been open to receiving medical evacuations, but what are the barriers? What makes it so difficult to receive medical evacuees, not just to evacuate them from the Gaza Strip, but for countries to receive them? What are the barriers? It baffles my mind to think about why people will not accept.
It is a very complicated and difficult process, not only because of the restrictions put in place by Israel in terms of visas, passage. They actually approve who is allowed to be evacuated at what time, and with only one caregiver. So it also can separate the families. And of course, with Palestinians leaving the occupied Palestinian territories, what is the right to return? right? So there are states that are anxious, rightly, that if you bring Palestinians out, how will they be able to go back, if at all, or to where? But these are things that must be called for. This a safe passage out with a right to return, a caregiver of your choice, and support. Some of the clinical care that's needed for these patients really is complex, and we understand that. But at the same time, we have countries in the region of ASEAN that have very developed medical systems, and countries like Malaysia, especially, that are politically really in support of Palestine. And so this is something concrete and easy to do.
Right. So definitely calling for more support from ASEAN, both diplomatically and both in terms of accepting medical evacuees. Can I also, look to Sudan, which is another humanitarian crisis unfolding? You were medical team leader in Sudan until recently. So can you give us an understanding of what's happening, the humanitarian situation in Sudan currently? What's missing from international media attention?
Well, it's just that, actually, Melissa. Sudan is the largest humanitarian crisis ongoing at this time, and it feels invisible to the outside world. It's been going since April 2023 as a conflict between two forces, the Sudanese armed forces and the rapid support forces, so SAF and RSF, and it's pretty much divided the country in half. What that has meant is there are very few organizations, international organizations, or even agencies that can operate with any form of sustained and large humanitarian response that can work across the lines on both sides of the territories. And that has left huge swathes of the population without any sort of needs, without any sort of support and care. But one thing that's really defining about this conflict, other than the fact that there's no political will internally or internationally to see its end, and the media really doesn't show a great amount of interest, despite us trying, what's really important about this conflict to understand is that acts of violence against civilians, against hospitals, against infrastructure. Drone warfare means that very few places are actually very safe. Even if there is a front line, there are besieged areas with hundreds of thousands of people in, for example, El Fasher, a city in North Darfur that has been besieged for months. And also violence that's ethnically targeted and sexual violence that are used as weapons of war. It's a really extreme situation with outbreaks, cholera, measles, with violence, as I've said, malnutrition, maternal mortality. It really is staggering.
Why do you think that Sudan's crisis isn't getting the same attention as Gaza, as Ukraine, as other areas? I mean, I'm just wondering what is needed to keep these crises in view, and what risk is there if the world continues to look away?
It's a really good question, and it's hard to gauge. I mean, we at MSF can't really gauge why there's interest or no interest in a political or in a scenario or conflict. I think what we do see is that we are trying very hard with our advocacy and our humanitarian diplomacy. In fact, we have more meetings about Sudan than we do about Gaza as MSF, with regional and international actors, both whether they're non-governmental or governmental. So we're trying our best, but how to gauge why there's that disinterest? How can I can't comment as MSF in that sense. So it's not for want of trying, is all I can say. But you said what's the effect? The effect of ignoring this and there being no political pressure externally or internally to resolve this conflict is you very much have this divided country and millions upon millions of people living in dire circumstances, and that is falling outwards. So you have in Chad, in South Sudan, a large number of refugees now, and cholera has broken out in Chad. It creates a large number of needs in regional countries as well. So the effect is directly on the people of Sudan, who are not getting, who have nowhere safe and are not getting care.
Right. Well, you mentioned a key ethos of MSF, which is medical neutrality. Is that under attack? Is the space for neutral humanitarian work shrinking? Is everything being politicized at this moment, including humanitarian aid?
It feels as though it does. It feels as though the space for humanitarianism
Mhm.
feels like it's shrinking, does it not? There is, as I observe, a rightward trend in politics, certainly around Europe and North America. And a shift away from global solidarity, I feel, and so in that sense, yes, it feels like it's harder to even gain access to the populations or communities that need support, and so it's concerning. But at the same time, we also see the opposite somehow. For example, when we launched our sort of global campaign for Gaza to bring to attention through the month of August and September that it is a genocide and that world leaders need to do what they can do to stop this, we saw a huge uptake across 35 MSF offices, the populations wanting to sign petitions, wanting to go out and demonstrate. That's hopeful. Right. So yes, we see both. There's hope there. Populations, the wider public, they see what's happening, and they want to support and help in the good cause, so to speak.
Well, from your bird's eye view, what are we not seeing? Are there other emergencies that worry you? Places where MSF is working, but the world isn't watching?
Absolutely. I think, when you say that, a couple of places come to mind. Firstly, a country, Haiti. Haiti is having a lot of armed conflict between armed groups, especially in the capital, where nearly 80% of the health system is actually non-functioning. And we've treated in the first 6 months of this year over 2,700 survivors for sexual violence. Sexual violence there between front line. Again, it sounds like Sudan as I describe it. Between front lines within the city of Port-au-Prince, with these armed groups fighting, populations are exploited and controlled with violence and sexual violence at times. So this is a context that doesn't get the attention that it needs. And another, I would say, is a region, which is the Sahel. So the Sahel is a band to the south of the Sahara that runs sort of east-west. And you have Mali, Benin, Burkina Faso, northern Nigeria, Niger, and then in the east, Somalia. Even Ethiopia, rates of malnutrition, conflict, instability, and these are all magnified by climate breakdown and climate change that's putting real pressure on the populations. And so we, again, going back to the aid cuts and humanitarian and global health cuts, we've seen, for example, a double the number of patients in our clinics in Somalia and Ethiopia this year than we normally would.
Right. Well, you talked a little bit about urging ASEAN leaders who are preparing to converge in KL, in Kuala Lumpur, for the summit. You are urging them to respond more to humanitarian crises. Can we break that down? For ASEAN country members, for Malaysia as ASEAN chair, what are the concrete things that we can do, both in terms of ASEAN leaders, but also the public watching and maybe pushing our leaders to do more?
Exactly. Thank you, Melissa. It's a good question. I mean, the first and foremost is to ensure the ceasefire holds, right? We need the ceasefire to hold, and also humanitarian aid to be massively expanded at scale to reach the people that need it the most. And that, as I said, includes food, medical supplies, shelter, fuel, and clean water. The other thing that we're calling for, and that's something that's very concrete, is for ASEAN with Malaysia to lead a regional mechanism that can expand the number of medical evacuations at scale. It's something that is very concrete and is manageable. We've seen it in countries like Turkey, Egypt, Qatar. So regional countries have taken hundreds, even thousands of patients, and would like to see that in Southeast Asia also. Well, and then the call there is for ASEAN to continue its role that we've seen, right, as a moral bloc and as a humanitarian bloc, right, to project unified leadership, to uphold international humanitarian law, because we've seen egregious breaches of those law, and we would like the ASEAN bloc to really continue to call for the upholding of that law.
Well, one of the reasons on this show, we speak often to MSF representatives, and I think one of the reasons why is this really strong ethos in MSF to bear witness, and I really appreciate that. And I do wonder whether you can maybe share with us a little bit about why it's important for MSF to bear witness when, for us who cannot access these areas. What role do you see storytelling as part of humanitarian work today?
I think it's really important because, on one level, it humanizes and quantifies the need. So if, for example, I tell you that 4 million people are displaced and there's violence in Khartoum and sexual violence and crossing front lines is difficult, that's hard to understand. But if we're able to, and as I said, I've been there, and I tell you that I speak of a mother who had to collect money through sexual work just to pay off the checkpoints to cross the front line, where her child then got abused in any case, to then arrive at the hospital, and they arrived too late, and they were bringing cholera patients from the village, and then some of those patients didn't even survive the journey. That tells you something a little bit more, and hopefully with quantifying that and personalizing and humanizing that story, one story of millions in all of Sudan, then it might motivate the listener, whether the listener is someone who sits in parliament and has a chance to maybe really change something, or a general member of the public who's then motivated to go on a demonstration, sign a petition, write a letter to your member of parliament. These things matter, and it's good to be able to just pay attention and have that sort of translated for you in that way. But then I don't also doubt, and I always want to say, in MSF, only 1 in about 10 of our members of staff are from outside and go in and come back.
That's right.
8 to 9 members of staff from MSF are from that area, and we're increasingly really want to see our own staff members tell their own stories, because not only are they doing the work, but they're living through it as well. And you have some very powerful testimony that really lands when you understand. I mean, my Gazan colleagues, imagine living in tents, explosions happening. They'd have to move overnight with an evacuation order, and then coming to work the next day and doing psychological counseling for the patients if you're the counselor, or doing physiotherapy for the amputated child. And so these are human, dignified stories that need to be told, preferably by people who are going through it themselves. And that's the power of testimony.
Well, you've been in so many crisis zones. You've spent so many years working in the field. Do you ever lose hope, or how do you remain hopeful about humanity? You talked a little bit about how the global solidarity that you're seeing gives you hope, but when you are on the ground and you're living through it, are there what have you learned about resilience from the people that you're serving?
Oh, I mean, so much, Melissa. And it's one of the things that really, it's a golden thread that runs through everything that I've ever done with MSF. Because, make no doubt that the first responders, or the responders that can really stay even in the hardest of circumstance, are usually local communities, right, doing it for themselves. In Khartoum, the emergency rooms, if you've ever heard of the emergency response rooms, you've now been twice nominated for the Peace Prize but not been given it. Or in Ukraine, the civilians that would cross front lines and take medications across to elderly patients of diabetes who didn't have their medicine across the front line. So that's the first thing, that communities more often than not are doing it for themselves. They're there, they're reacting, and they're the first humanitarians ever. And we just come in and want to support, to be honest. So that's genuinely the beautiful thing. But also my colleagues, as I've mentioned, you know, I remember the first time I really felt it so strongly was in Ebola in West Africa. Huge epidemic, flights closed, we fly in, those countries were under blockade. And the staff members sat me down and were like, can we just check? You know, you're coming here, there's no cure. Do you know what you're doing? This means so much. Are you crazy? It's like, no, but this is what we do. And you sit there with your colleagues, and then they tell you stories of how they'd been ostracized and their children bullied at school because the children know that their parents or the parents of their friends are working with Ebola, and Ebola is so frightening, they didn't want them in the school. So they're doing this under huge pressure and still coming to work each day. And as I said, in Gaza, in Sudan, it's really also about my colleagues as well.
Yeah, and I'm so sorry to hear about the loss of some of your colleagues, particularly recently in Gaza as well. I'm sorry for the loss.
Thank you. Thank you for saying that. I mean, it's not really a loss, right, Melissa? They were killed. They were murdered by Israeli drone strikes. These last two colleagues, Aboud especially, is a physiotherapist who I worked very, very closely with. And he, again, that ethos of refusal, he refused to accept a poor quality of care. And we had no crutches, we had no wheelchairs because of the blockade. And he was having them made, and he made compression garments. He brought in a tailor, and he was like, we can do this, because burns victims need very special sort of, and he just refused to accept that we had no supplies. He found a way, and he worked day in, day out, and doing burns and trauma care rehabilitation in Gaza for 18 years, as he did through how many wars. He got killed by Israeli drone strike, and he used to be an educator of MSF physiotherapists abroad. It's not just the loss to his family and to his colleagues and to his patients in Gaza. It's to the he was an expert physiotherapy for trauma and rehabilitation in burns and trauma. And and he's just one of 15 colleagues, and they're 15 of 1,700 more than that have been killed. And so, yes, it's a huge loss. So thank you for your condolences.
Well, thank you for telling us about him and his story, and thank you for sharing some of the insights of your work, Dr. Javid. I really appreciate your time. Thank you.
Thank you for having me.
That was Dr. Javid Abdelmoneim from Médecins Sans Frontières, MSF, Doctors Without Borders. Wrapping up this episode of Consider This, I'm Melisa Idris signing off for the evening. Thank you so much for watching, and good night.